Are you tired of starting a new exercise routine only to be sidelined by your calf or your Achilles starting to hurt? A lot of people struggle with this when they're running or start back into running again. We can help. I'm Dr. Dukes with Body in Motion. This is super common with people that either jump into a fitness routine and the rest of their body isn't prepped and ready for it. So there's a lot of things that could cause Achilles tendinosis. But we're going to cover how we would assess it and some exercises and treatments in this video. So first thing, when we think of Achilles tendonitis, it's the back part of your calf. And it affects your dorsiflexion of your ankle. It also has an effect on plantar flexion of the ankle. So, and there's a lot of things that can cause it. It's not always the calf that's the problem, but it can be. There's other areas that would affect it, right? So we think about if there's a limit in the foot or in the anterior ankle, or if it's only in the back, it could be a precursor to someone developing plantar fasciitis. There's all kinds of things that could spiral from this. But if we're thinking about pure Achilles tendinosis or a calf strain, we've got to think about dorsiflexion and plantar flexion most of the time. So we're gonna look at that. See, can the patients equally dorsiflex that knee or the ankle so that the knee can go past the toes adequately on both sides, and is it symmetrical? Then we look at some toe function and some different things and check to see if the calcaneus moves the same way on both sides. But then we're going to go into what kind of treatments we would do. So if it's acutely strained, we would use dynamic tape to offload the tissue to allow it to heal. That works really well. Sometimes we would do that as well as doing a loaded myofascial work on the affected area itself. That also works when they're actively using it. It can increase nerve activation, as well as a bunch of other positive effects to bring in blood flow to the area, allowing healing, right? So now let's think about it. So the Achilles is a huge tendon. The last thing we want to do is immobilize it and stop using it. It actually does want to be loaded. We just don't want to overdo it or do anything ballistically when it's injured. So once again, we wouldn't put an Achilles strain or Achilles tendinosis in a boot if we didn't have to. We would want to passively load it to the patient's tolerance and then build up to having them do some calf raises and then eventually single leg calf raises, always with the toes up a little bit so we get a little bit more eccentric load on the calf itself with the downward motion, which is common for running and really beneficial. So ultimately, we want to load the Achilles. We want to allow the tissue to recover if there is an acute injury, but there's a lot of stuff that we can do to help. It is a multifaceted thing. There's usually not just that going on. So if you struggle with something like this or you'd like a little bit more information, please reach out and book an appointment online or schedule a discovery call to hear more about how we can help you.